What's going on, everyone? Happy Wednesday to everyone. Hopefully, everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Wednesday edition of the Pandemic Update for Wednesday, June 26, 2024. If you're new to my channel, this is where we do the daily pandemic update on all things COVID and any other virus that could be a health threat to you. Let's face it, there are a lot of different viruses out there. Each and every one of them carry a various different risks. COVID being the king of the crop. COVID can cause long COVID. COVID still causes death. COVID still causes hospitalizations. It's something we need to take seriously. But now that we're in the COVID era, some people's immune systems get weakened and, well, there's a lot of other viruses that are spreading out there, and it seems to me like people are catching them easier. You need to be informed with the rate that they're spreading and what is going on with all these viruses. That's what we do here each and every day at Data Report. I give you the daily pandemic update. Want to stay informed? Subscribe to my channel down below. Share these videos with anyone you know. If you like the videos, give them a thumbs up. The more people hit that like button, the more YouTube pushes this out throughout the algorithm. Let's try for over 150 likes today. Let's see if we can make that happen. Of course, like I said, share these with anyone you know and leave a comment down below. All right, starting off today, we do have several news stories. We're just going to pull from Twitter today. We'll just go through a bunch of these. Then we do have new data from BioBot. I will show you some of that. And then we have all of our daily data, including New Jersey, New York State, and a state we have not looked at in quite some time, which I'm saving that for the end. All right, starting off today, over in Africa, new strain of monkeypox. Well, it's called Mpox now, but they're going with monkeypox. New strain of Mpox causes miscarriages. Yeah, this is not good. And spreads rapidly without sexual contact. This is not good. A new strain of, we're going to say Mpox, that causes miscarriage and has a fatality rate of up to 10% is spreading rapidly in Central Africa. We did retweet that. If you want to read the full story, you can do that. The reason why we don't read full stories during the video is because, well, if we read each and every story in its entirety for each video, we would be here 45 minutes to an hour. No one wants to sit through an hour-long video each and every day. Next story. Take a look at this. COVID over in Italy. Cases have almost doubled compared to 3 weeks ago. You can see 3 weeks ago, 1,329, then 1,807. Now 2,000, what is that? 2,083. So this level continues to go up. Hopefully we see it peaking soon, but at this point in time, Italy continues to rise. All right, some news on remdesivir. Remember this drug? This was one of the early day COVID pandemic drugs. It was tied to a 54% lower risk of death among hospitalized COVID patients. By day 28, 70% of recipients of remdesivir plus standard care and 53% who received standard care alone had been released from the hospital, a 16% difference. Shows why, in the early days of the pandemic, some of the elites, those who were more fortunate, were being given remdesivir. And guess what? It looks like it was working. Now, if you want to read this full story, matter of fact, we did not retweet this, and we need to retweet this, because this is coming from CIDRAP, a very trusted source. I often do post their studies on my website. I'll make sure I make a note, or I'll put this in my pile of things to add to the website, where there's quite a few things. And this is getting into our archives. All right, moving on to the next thing. Here we go, yet again, another country. Taiwan, COVID-19 hospitalizations jump 31%. Last week, 817 people were hospitalized due to COVID-19 and 40 people died. So they have 817 people in the hospital, and one of their drugs is having a shortage at this time as well. Moving on. COVID-19 cases. This is coming from Daniel Beckman, who tweeted this out. COVID-19 cases have increased substantially in the U.S. these last few weeks. It should say few weeks. These last weeks. 16.7% more deaths in the most recent weeks, 25% more hospitalizations, and 14.7% more emergency visits. Now, we got to pause for a second and take a little detour, because we get some people that post down here, oh, COVID's over, your lies and full of it, blah, blah, blah. Well, let's face it. Yes, deaths are not as high as they were back in 2020 or 2021. But when we do get waves of COVID, which we are getting, we're clearly in a wave of COVID right now. There's no questions about it. The deaths do continue to rise. And you can see here, the deaths did go up 16.7%. When we get a wave of COVID, emergency department visits rise. Yes, some may be because of other reasons, and they just happen to be positive with COVID. Others could be, no, they're positive with COVID, and their symptoms and issues are so bad that, hey, they need to seek emergency care. Either way, things are rising, and they still rise with each and every case of COVID. And when it comes to the emergency department visit, if they're showing up for something else but do have COVID, think of it this way. Each time someone shows up to the emergency department, when it starts happening at higher levels, say you're someone that does not have COVID, and you have to visit the hospital, or say you're someone that's high risk. If you're visiting the hospital and COVID cases at the hospital are rising, guess what? The number of people infected within the facility is rising. Your percent chance of catching COVID while using emergency health care, such as the hospital, or maybe even just going to visit a relative who's currently in the hospital for some reason, your chances of catching a case of COVID go upward, which is why it is important in healthcare facilities. You need to mask when there's increased hospital transmission in a hospital because more people are infected. Guess what happens? Your chances of getting infected goes higher, and if you are a high risk person, right now is entering into a very risky time for you to need to use a hospital. So unfortunately, if you're high risk, try and put off visiting a hospital as much as possible. Right now is a dangerous period to do that because levels of transmission going around and levels of people infected with COVID at a hospital at any given time are up right now. All right, moving on now to this. Oh, Spain. Spain is rising as well. Spain test kit sales skyrocket amid COVID spike. In the first half of May, we sold 18 tests, and in the first half of June, we sold 180. 10 times more, said one Madrid pharmacist. So yes, the need to buy testing at the pharmacies in Spain is going way up. 18 versus 180. Wow, that is a humongous increase, and it shows you some people still do want to go and take these at-home tests. Thank you for doing that. If you're sick, please get tested. If it comes up negative for COVID, take another test, because you never know. It could take a couple days for the test to actually turn up positive, and we don't want you to go out thinking, well, it's not COVID, I can go out false positive. Turns out you did have COVID. Then you infect someone who's high risk, and they hospitalize, or they die, or they get long COVID. It happens. It can happen that way. All right, moving on. BioBot did have an update today on their respiratory viruses. We can see in all regions of the country, influenza A and influenza B did drop. RSV did drop as well. COVID, it did rise in some regions, and it did drop a little in the West Coast. Let's go down. Let's just scroll down here to COVID. We're not really concerned about the other viruses at this time because RSV, influenza, and A and B are not really a big issue right now, aside from bird flu, which is something else, which we're not talking about at the moment. We don't have any news on that today, but I'm sure we will before this week is done, because there have been a couple things that maybe tomorrow we'll get to that. All right, COVID-19. Wastewater data show that COVID-19 activity and community viral load held steady during week 25. The national average SARS-CoV-2 wastewater concentration is now 358 copies. And it says clinical metrics continue to show some signs of increasing COVID-19 activity in week 24. Test positivity increased, currently at 6.6%. COVID-Net reports that the COVID-19 hospitalization rate held steady, currently at 1.3 per 100,000 persons in week 24. Deaths due to COVID-19 held steady and currently represent 0.7% of all deaths in the U.S. They're saying it held steady, but you saw the CDC data. The CDC is saying there has been an increase, and you can see here on this chart that according to BioBot, things have leveled off slightly. That may only be because of a couple states in the West Coast. For the most part, the U.S. at this time is rising, and I will show you more data that shows things rising as well. All right, let's move on. We'll take a look at maybe tomorrow we'll read some more of the regional stuff because we still got quite a few things to take a look at today, and I did want to keep this at or under 20 minutes. Drum roll, please. National allergy map is at 42% at this time, and we can see here the West Coast. Then the Northwest is where the worst allergies are. The Ohio Valley and Chicago, you're not too bad today. The Southeast is not too bad. Texas, a little bit of yellow for you. And we can see here up in the Northeast there is some yellow as well. Taking a look at air qualities, and I have to zoom this out, you're going to see a mixed bag of things today. Air qualities in the East generally are not doing too well. Let's refresh this once again. Generally in the East, yeah, you're seeing a lot of yellows. You're going to see some oranges as well. Here we go. Along the I-95 corridor from Florida all the way up to Maine, there's actually quite a bit of orange ongoing up in Maine. Yellow in New York City, orange in Connecticut, some orange and yellows in Pennsylvania. As we come down to Alabama, Georgia, similar deal for you, yellows, even a few oranges. The plains from Texas all the way up into the Dakotas. It's not doing too bad. West Coast is not bad, but we do have wildfires in California. And you can make it out here that it looks like near Fresno, California, just to your northeast. That definitely has to be a wildfire ongoing. I will investigate that, probably tweet about it over on my climate page later on today. I'll show you that Twitter in just a moment. Taking a look at what's going on now with heat-related illnesses. We do need to refresh this. For some reason it glitches if it's not refreshed after so long. Heat-related illnesses generally, as you can see here, they're increasing across most of the country, especially in New York, up in New Hampshire, portions of Vermont, and you can see here in California as well increasing. Southeast is increasing. Even a few places in the northern plains are starting to increase now as well. Taking a look at what's going on with this, haha, here we go. My climate channel. It is Climate Data Report. That's just my X. You can go become a follower there and find out everything I'm tweeting about weather and climate. And of course, here's my climate channel at Climate Data Report, where I do tweet about weather, or excuse me, do videos about weather. I tweet over on X. Here I post videos on weather. And you can see we posted today's update about thunderstorms that are expected in many places. We'll be talking about that again tomorrow, too. It's summertime. It's what happens. We'll also be talking about heat as well. In Philadelphia, 803 EMS incidents have been reported for Tuesday. So that number, yeah, once again, it is over 800. Have not been below 800 now for several days. Taking a look at Montgomery County, Pennsylvania, and wow, I'm seeing a lot of bad calls here. There are currently 16 calls, but take a look at this. In Norristown, Pennsylvania, cardiac arrest, respiratory emergency. We also have Cheltenham, Pennsylvania, cardiac emergency, dehydration, respiratory emergency, several vehicle accidents, cardiac arrest again, this time in Pottstown, multiple seizures, 1, 2, 3 calls for seizures. And yes, seizures have been something that have been going on for decades. That takes a very long time. We do know there are a couple studies out there that say COVID, which we know causes brain problems, can also lead to a higher risk of seizures. There's vomiting calls. There's cardiac emergency again, another respiratory emergency call in Lower Providence. I hope we see some better news in Chester County, Pennsylvania. Let's refresh this. Yeah, better, but sick person, exposure to heat and cold. That's, heat-related illness, heart problems, fall and lift assist. So much better in Chester County than Montgomery County, which has a slew of severe calls right now. That's not good to see. Taking a look at Walgreens this week, and the positivity rate at Walgreens this week is 34.1%. Let's take a look at Canada. Let's refresh this in case they had an update. They may have had an update this afternoon. 16 wastewater sites in Canada for COVID are showing an increase. 39 have no change. 10% are showing a decrease. 1 is high. 6 are moderate. 16 are low. New sites, there are 42 of them at this time. Taking a look at what is going on with emergency department visits across the United States, and I do have to show this to you. Across the United States, emergency department visits, these are for people diagnosed with COVID, do continue to rise at this time, and this is probably going to continue for quite some time. If anything, it may pick up the pace even more post 4th of July, which, hey, we're just about closing in on a week away now from 4th of July. Start thinking about that. If you're starting to test positive for COVID soon, Yeah, that means you can't participate in all the festivities of 4th of July. I'm sorry to say that, but that's the way it works. If you're infected with COVID, it's not something, oh, well, in a couple days you get better. No, some people it's 5 days, some it's 7 days. Look, when you're positive for COVID, you need to treat your case individually for you. How is it impacting you? Some people do clear up and get better and test negative in a couple days. Some people stay positive for 10, 14 days. I mean, we've seen some really multiple week positive cases. It happens. I'm sorry. If you test positive for COVID and you're still positive on the holiday, you can't go meet up with your friends and family for barbecues and stuff. You need to take precautions, and unfortunately, you need to rest up and hopefully try to get better. You will get better, hopefully, but you just can't go out and spread disease to other people. It's just something you don't want to do. Epidemic status is growing or likely growing in the majority of the country. Nowhere is declining. Some places are not estimated. Some are stable or uncertain at this time. Taking a look at what's going on here with the latest variant, KP.3 variant does lead the way at 33.1%, followed by KP.2 at 20.8%, LB.1 at 17.5%. Taking a look at New Jersey, 255 people in the hospital, 20 people in the ICU, on a ventilator, 5, and discharges today is 49. Quite a few people discharged, but again, when the number of people in the hospital goes up, the number of admissions, the number of discharges, that volume all increases. Taking a look at New York State, and hopefully we have something for cases today. We have it. And no, we still don't. It's 1,180 was the most recent report. There has been an update on a new number for hospitalizations, not necessarily being from yesterday, that they're always a few days behind, as I'm being told. Taking a look here, New York State, looks to me like we're starting to pick up the pace. The hospitalizations, though they continue to rise, it's doing so just ever so slightly faster now. And 799 hospitalizations today, 79 people in the ICU. That number is up as well. So both numbers have increased. And let's take a look at New York City while we're at it. This will do its refresh and all of that business. But let's take a look at what's happening in New York City. And we can see here, New York City this week has been increasing. I want to say significantly now. 406 people in the hospital in New York City, 50 people in the ICU. You can clearly see here, it's starting to pick up the pace. And though, be it's not at the pace of, you know what? It's about right now. Yeah, it is at the pace of the early winter last year. So that is interesting to see them starting to increase this much. Hopefully, this won't be long term, but hey, we just report on it as we see it here happening. Moving on to our final thing for today, a state we have not looked at in a long time. Which state is that? Virginia. We're going to try and show you something from Virginia, and we can see here the emergency department visits for COVID in Virginia are starting to increase. Let's click on cases and see if that gives us anything here. Remind you, we haven't looked at this in a long time, so we're both looking at this together here. And it may be some things don't load. You know, some dashboards just do not work anymore. And no, this is just going around in circles. Can we click on wastewater surveillance? Will that give us anything? I hope this gives us something. We can see it does go around. Okay, we do see some areas are starting to increase. Northern, what is this? Parkins Mill. I'm seeing red, which shows increase. I'm also seeing orange, which shows plateau, which doesn't mean increase. It just means, I guess, flat at this time. And then we do see several areas that did not report. Alrighty, folks, that does it for the Wednesday edition of the Pandemic Update. We will have another Pandemic Update again tomorrow. If you enjoyed this update, give it a thumbs up. If you felt like you were informed and you would like to continue to be informed, guess what? Hit that subscribe button down below. I want to inform as many people as possible. I want to double, triple, quadruple the size of this channel. You know why? Because if I do that, I'm informing more people of what's going on. And who knows, maybe by keeping people informed, we'll prevent some COVID cases. We'll remind some people, when you're sick, get tested for COVID. And if it ends up not being COVID, get tested for something else. There's multivirus test kits. They're starting to become a thing here in the United States. We haven't had them, but they're starting to become a thing. You can detect if it's other viruses now as well. And please, I know you may not want a mask anymore, but could you at least do this for me? If you're visiting a healthcare facility, doctor's office, specialist, hospital, Please mask up. You're not only protecting yourself, you're helping to protect other people. Let's help keep the high-risk people safe. Let's keep everyone safe, okay? Share these videos with anyone you know. Leave a comment down below. Hit that notification bell. You will know when I do my daily updates. I will see you all again next time. Until I see you again next time, stay safe, everyone, and have a fantastic Wednesday afternoon. Thanks for watching.